Mrs. Gina Hood has been recently recovering from surgery. She needs change of hospital gown, but she has an IV infusion with volumetric pump. You ask a nurse for assistance with the procedure. The pre-procedure steps will be performed by the PSW and nurse. She will disconnect the IV from the pump to change the user's gown and will reconnect it once she has been changed. While doing so, she will equally check the IV site for anomalies. IV infusion can serve several purposes: hydration or a means to inject medication, for example. A flexible catheter is thus inserted by a nurse with tubing attached. Sometimes infusion is controlled with a volumetric pump. The nurse is responsible for the proper working of the IV infusion and volumetric pump. The following should be checked with IV infusions: redness, pain, and/or heat at the insertion site, the presence of induration, hardness at the insertion site, presence of blood in the tubing or in unusual quantity around the infusion site. Any of these signs should be immediately reported to the nursing staff for remedial action, as these may be indicators of serious health hazards.
So we're going to change your hospital gown, okay? We're going to put a new one on, all right?
Okay.
Gown changes are performed as follows. A clean gown is placed nearby. The hospital gown is removed from the non-IV side and pulled over to the IV side. The gown is pulled along the IV tubing through the sleeve up to the bag. The IV bag is pulled through the sleeve, keeping it above the patient. Then, the bag is pulled through the sleeve of the clean gown, and the bag is put back on its hook. The gown is pulled along the tubing and through the user's arm on the IV side, and then the other arm is pulled through. The gown strings are tied at the neck and back. Some hospital gowns have snaps on the shoulders, which facilitates the procedure.
All right, so next step, I'm gonna go get the nurse, okay, so she can put the tubing back into the machine. Is that okay?
Yeah.
I'll be back after.
Always ask for assistance from a nurse when IV infusions and pumps require handling, as incorrect handling could have repercussions for the user.
All right, the nurse is gonna come and see you. So we're gonna get up, okay, and have a walk.
Oh,
Okay,
yeah.
well, when you get up, just be careful not to pinch or snag the tube, okay?
Okay.
Perfect.
But you're going to stay close.
I will
huh?
stay close.
Okay.
Okay.
The user can walk about with an IV infusion if it is attached to a wheeled stand. Also, make sure the IV bag is above the insertion site at all times. The pump should be disconnected and then reconnected to an outlet to stay charged.
Okay. Okay. Turn on your side. Turn to your side. Okay. Perfect. One second here. Okay, you're gonna push your hands on the bed to get up, okay?
Okay.
All right. Get up. Oh. 2 seconds.
Yeah.
All right. Ready to go?
Yep.